Great, thank you very much there for the introduction. So we've got about 20 minutes to run through this topic, and as you hear, we've got a poll at the end, so do get ready for that as well. I'll intend to run to time so we can fit that in. So yeah, good morning. Thank you for coming to the session. I'm Dr. Robin Clark. I'm the Medical Director for Bupa Global and UK Insurance. So what I'm going to do is a bit of a whistle-stop tour through inclusive health and being, what we think that's about, and some of the sort of stats and evidence behind why that's important. So without further ado, you may notice I'm using my phone for notes. This is my attempt at eco-credentials and increasing my or rather reducing my eco footprint. So first time I've used it, so if it goes wrong, I do apologise. So, as it says there, employees are now looking for a culture that aligns with their values, flexible working and attractive benefits. So this probably doesn't come as a surprise to many of you, but I think really what we're stating here is that the expectation is now that it's more than just a salary. And there's a number of factors driving this. And certainly COVID-19 caused quite a major rethink in how people live their lives and what they expect from work, what they expect from their work relationship and their work-life balance. So work-life balance actually came out as the #1 priority for UK business leaders, and that was from our Bupa Global Executive Wellbeing Index. And the work-life balance reassessment that I've just described, what that led to was what's commonly known as the Great Resignation. So quite a lot of movement of people and quite a lot of skilled employees either leaving the workforce or changing how they interacted with their employers. The latest YouGov data actually shows that trend is continuing. And if you look at the UK working age adult data, in the past 3 years, more than 50% of them have started a new job or are looking for a new role. So a significant number of people, and a third of people state they're likely to consider moving within the next 12 months. So again, quite an intention there in terms of movement in the market. I think the other thing to watch out for, people movement is expected to accelerate even more as Generation Z enter the workforce. So those are the people born in the late 90s, early 2000s. And I think the importance of that is there's multiple studies and statements indicating that Gen Z put a high value on the health and well-being and social and environmental responsibilities. So I think that they're also very willing to make career moves in order to address that. So very much something to watch out for. The other reason you need to watch out for it is they're now the largest demographic group in employment, with the World Economic Forum estimated that they're going to make up to 27% of the workforce by 2025. So a significant chunk of people there who are willing to move in order to meet the things that are important to them in terms of the workplace. So just to hit that point home once more, 1 in 3 of them would actually turn down roles in companies that have poor ESG credentials. And more than half of them would actually take a pay cut to work for a business that better reflects their own ethics. So again, I think really shining a light on the fact that this is a group of people you need to pay attention to. So I think the argument I'm trying to put forward here is there's a new emphasis on work-life balance, is an increasingly competitive jobs market, and there's a shift in the expectations of what businesses are expected to deliver. And if you look at the Office of National Statistics, they're currently stating that 13% of businesses are struggling to fill vacancies, and about 1/3 of businesses in some sectors are struggling. So there's obviously an impact there in terms of what it means in reality on the ground. So inclusive health and wellbeing policies are essential to attract and retain this talent. So an increased focus on workplace wellbeing and mental health will be key to recruiting the best talent. And our Bupa Global Executive Wellbeing Index showed that almost 1/4 of the executives that were surveyed said that clear strategies around diversity and inclusion were also critical for improving employee engagement and wellbeing. And what we know is that engagement is directly linked to the bottom line. So higher the engagement, the higher the likelihood of business performance being better. And research from Glint also backs this up. So Glint being the global employee experience and engagement platform, they've identified that highly engaged teams are twice as likely to increase revenue and profitability compared to teams with low engagement. So again, very much singing from the same book here. The next stat comes from the Mental Health Foundation, who've identified that addressing wellbeing at work increases productivity by as much as 12%. So again, some really quite significant numbers coming through. And then from Deloitte, so Deloitte, the accountancy and professional services firm, have identified that every £1 invested by employers in mental health now delivers a return of £5. And that £5 is actually increasing all the time. And again, just to add more evidence to this, there's a Lancet study that says, actually, if you invest in managers, the return is even greater. So for every £1 spent on manager mental health training, the yield, nearly £10. So highly, highly significant. So I think the message here and the return on investment is loud and clear for all to see and all to hear. So we've been talking about the challenges: recruitment, retention, work-life balance, ESG, and engagement. And so these are directly or indirectly linked to employee health and well-being. And if I go back to Deloitte, if I quote one of their recent white papers, when organisations support the well-being of their people, they can experience lower turnover, lower burnout, as well as greater productivity and engagement. So I think I've made the point in terms of how important this is and some of the stats around the sort of return on investment that you can expect. So what does workplace inclusion and health equity look like? So firstly, we need to recognise that there's differences between us, differences at an individual level, differences within our organisation. So we're not all the same when it comes to health, and there's no one-size-fits-all solution that therefore can be applied to everybody. So there's many attributes that shape our health and well-being, whether that be age, sex, ethnicity, socioeconomic background, for example. So I'll just give a few examples of how that can impact people differently. So we know that age increases the risk of cancer and chronic conditions, so high blood pressure, diabetes, heart disease. But that's not to say that young people are immune. So younger adults, we know, tend to struggle more with emotional well-being. And if I give some stats from our Bupa Wellbeing Index, the over 65s were 3 times more likely to report very good mental health compared to those in the 16 to 24-year-old group. So 3 times more likely to report very good mental health. I think, that's a very stark fact there. In terms of sex, that affects which type of conditions you're more likely to get. So things like autoimmune conditions, so multiple sclerosis, rheumatoid arthritis, more likely to affect women than men. Neurological conditions, so we're talking about things like Parkinson's disease, for example, more common in men than women. Ethnicity, again, there's an imbalance there. So people of South Asian or Afro-Caribbean background have up to 2 times the risk of developing type 2 diabetes compared to white Europeans. So lots of reasons why health equity affects people, or rather the lack of health equity is affecting people in different ways there. But I'm possibly making this sound a little bit too simplistic, because actually the correlations, there's lots of confounding factors and interrelations here. So if you think of socioeconomic factors, so we know that this influences the risk of cardiovascular disease, and in turn cardiovascular disease is influenced by lifestyle choices, so typically diet, smoking, exercise, alcohol. But a big study, 450,000 people, looking at 450,000 adults, actually identified that only 12% of that increased risk could be attributed to those lifestyle choices. So the interesting thing that they were proposing, which is backed up by other evidence, is that health outcomes are also impacted by health literacy and access to health resources. So actually, we're back to that old adage of knowledge is power. So if I just reposition it slightly, what I'm saying is health knowledge plus access to timely treatment equals an ability to alter the course of your disease. So again, if I reposition it slightly more appropriately to the audience today, well-communicated health information plus an ability to signpost to services equals better outcomes. And I think that's all why we're here today, really, isn't it? So how does your organisation take the next steps? So each workforce is unique. So you need to start with identifying the needs of the workforce and initiating those open two-way conversations about health and well-being. So I've got some stats here which are taken from 58,000 health assessments done during 2021. just to give you a feel for some of the areas that you may want to be considering in either your own organisations or the organisations that you work with in terms of areas that potentially are of significance. So 41 customers who had a health assessment were overweight, 21% were obese, 39% were inactive, perhaps not too surprising given the two previous figures. A third reported insomnia and sleep problems. 3/4 had musculoskeletal problems that were severe enough to cause some limit to their range of movement, so that's really quite significant. Ooh. There we go. And 44% were at risk of poor mental health. So I think whichever way you look at that, there is an awful lot going on there. And that's a very, very big sample size, 58,000 people. So there is highly likely to be some relevance, as I say, to your organisation or the organisations that you work with in terms of some of these findings are likely, at least in part, to mirror some of what you're finding at a local level. So, providing health support which addresses these challenges will improve well-being and productivity, which is true, but also don't forget the need to target specific groups. So, and the purpose of that is to improve health equity, but also to support the recruitment and retention of diverse teams. So I've got 3 examples here just to talk through. So the first one is menopause. So the number of women who will experience menopause whilst they're in employment is increasing. And I think the number here is really quite enormous. So 900,000 of those women quit their jobs every year, at least in part due to menopause symptoms. So I think really there's a huge opportunity here that we're calling out in terms of things that could be done to better support and retain this talent. And that could be fairly straightforward things that potentially you could consider. The ability to use a fan or adjust the air conditioning, access to cold water or checking with your employees whether the facilities are appropriate for them. Adapting uniforms to be more comfortable or allowing some flexibility around staff dress code, things of that nature. And the size of this problem is one of the reasons why Bupa is very much looking to roll out resources and support in the area, and why we've got the mental health helpline for our insured customers, which is available 24/7 in order for people to access menopause-trained nurses and help them through these kind of situations. The next example is around neurodiversity. So another way to promote inclusive health and wellbeing is to attract or to seek out and support those members who are neurodiverse. So we know that people with neurodiversity can bring different sets of skills and talents to your organisation, whether that be the level of focus, visual analytical skills, multitasking, memory or observational skills. So we know that this is a cohort of people that some organisations are actively trying to recruit and retain within their organisations. So brand names such as Microsoft and AstraZeneca actively working to nurture neurodiverse talent. So again, some steps that you may wish to think about in terms of supporting those people around perhaps routines, or consider your routes and styles of communication, and does it suit everybody? What's the sensory environment like? So do people or will people benefit from noise-reducing headphones, filters for computer screens? How is the lighting? Have you got quiet rooms if people find that is an environment that they're more likely to thrive in? So all of these things to be considered. And then the final example, I think employers can do more to support our disabled colleagues. So whilst UK law says we should make, as employers, reasonable adjustments for colleagues with a disability, actually, as it says here, 1/3 of disabled employees actually don't request those adjustments because they're concerned about how that might be interpreted and whether they will be considered differently as a result. So again, I think some of the adjustments that can be made cost very little or nothing, so certainly not something to be overlooked. And then my final slide is an example of how behavioural insights can be a transformative tool. So behavioural insights is that combination of psychology, sociology, behavioural economics and anthropology, and how that can help for health interventions to have maximum impact. So the example on the screen is a Bupa corporate who approached Bupa concerned that their engineers who were out on the road had a high risk of developing mental health conditions. And they'd also noticed that the utilisation of Bupa's Healthy Mind telephone service was low. So they asked us to help. We scoped out the problem for them and identified that, yes, there is poor awareness of the Healthy Mind service, but also there was a reluctance of their employees to engage with the mental health type services until they were truly overwhelmed. So our behavioural insights team, together with the corporate, worked on a solution which involved putting stickers in the engineers' vans, highlighting the Healthy Mind service, using language that resonated with the largely male audience, and then supported the managers with tip sheets around how to have conversations, how to signpost, and how to enable people to get the help that they needed. And that ultimately was the outcome here. There was a big increase in awareness and more staff accessed the care that they ultimately needed. So I'll just start to wrap up now, but just to, again, give you a few figures to highlight the importance to business here. So analysis by McKinsey showed that companies in the top quartile of gender diversity are 25% more likely to enjoy above average profitability than those in the lower quartile. And those with greater ethnic and cultural diversity are 36% more profitable than those in the lowest quartile. So I think my final points are there's big rewards for everyone in this area. There's an opportunity to create a sustainable advantage. And the takeaway being, if you look after your employees will look after business.